Welcome to Chronicle Corner. Today, we have a very interesting guest with us today. It's a guest who has been on social media. It may be someone you have actually seen. This person was born in the beautiful island of the USVI St. Croix. She's the sixth of 7 children. She went to the University of the Virgin Islands, went to Howard University, and now she's a doctorate candidate at Wharton University. She told me she has 2 gifts in life. She has been married for 25 years, and she has a son who is involved in her missionary work. Ladies and gentlemen, let us introduce Mrs. Ursula Roberts Allen. Welcome, Ursula.
Thank you, Clem.
Very good. Thank you for coming on Chronicle Corner. And for all you who have not heard of Ursula Roberts Allen, let me remind you who she is.
That is for folks who are showing symptoms of COVID-19. Our symptoms as Blacks are different. You don't have a cough, you don't have a temperature, yet our folks are dying at a higher rate than any other nationality or group.
Yes, ladies and gentlemen, that was Ursula Roberts Allen, and that was just a few weeks ago. And believe it or not, in those few weeks, Ursula, when I checked, you had approximately 1.7 to 1.8 million views already. So now 2 questions for you. First of all, when I saw you, I was shocked. I know you are not one for media, social media. First of all, you don't like it. So I was like, is that Ursula? Secondly, so first of all, what made you do this? And secondly, how has your life changed since then?
Well, to be honest with you, the impetus for the video, I really give the credit to Pastor Patrick Graham.
Okay.
We, as you know, in this time of quarantine, we've been having, I work with the Adventure Association for our church, which is the children's scout group from ages 4 to 9. As the executive coordinator for our conference, we've been having these weekly meetings as we try to push ministry forward. And they are coming at the end of my day. And usually, if you know Pastor Graham, he tends to poke at you. And usually I can give as good as I get. On this particular day, he was poking and I wasn't responding. And he's like, okay, Ursula, what in the world is wrong with you? I said, you don't want to know. He's like, yeah, we want to know, because that's not like you to be so quiet. What's on your mind? And so, you know me, if I'm passionate about something, I'm gonna give it my whole go. So I told them what I was feeling, and then I apologized because this is supposed to be a 15-minute meeting, and I about took the 15 minutes.
Okay.
And so when I was done, they started clapping, and I was like, why are you all clapping? They're like, Ursula, we've never heard that before. Where are you coming up with this information from? And I'm like, well, that's what's making me mad, because this is what we're seeing in healthcare, and we're not hearing it on the mainstream media. So his thing was, Ursula, you need to put it out there. You need to put it on Facebook. And I'm like, me, I don't do Facebook. I go on Facebook when I need to decompress and just look at stuff and enjoy what other people are posting. So that was like Tuesday, and he literally dogged my heels all week. And on Sunday, he's like, Ursula, I still don't see the post yet. And I'm like, Pastor, I don't even know what you're telling me to do. I don't even know how to do it.
Yes.
And so he walked me through putting out the what I needed to do to put the post on Facebook. And it was like a debate. I had prayed about it because that's what I told him I was going to do. I was going to pray about it. I was going to seek God's guidance. And he was like a nag. He nagged me about twice or three times on Sunday. And I'm like, you know what, let me just get it done, get him off my case. And so I did it kind of like right after one of the meetings. I had already changed my clothes to get ready for that meeting. And I said, you know what, before I change my clothes back, let me just do this. And when I was done, I took the video down to my husband, and he's like, you know, my husband, he's a critic. And so he's like, well, maybe you shouldn't have. And I'm like, you know what? I'm going back upstairs and I'm going to figure out how to pull this thing down, because I know this isn't what I wanted to do. So that's how I was feeling. But then I looked at it as when I came back upstairs to try and figure out how to take it down. It already had respondents to it. I'm like, shoot, I can't take it down. But I literally didn't pay it any mind. I'm one of those people, I got a list of to-dos and you are off my to-do list, it's done. And so I went about my merry way, and I'm at work on Monday, and Pastor Graham is calling me, and I'm like, listen, church can't be now because I got to do my work. The phone goes all day. And so I go from one patient to the next, or one staff to the next, and I don't have time to do it. So I'm texting him to say, I'll get back to you later. And he's like, no, you need to call me now. And I'm like, he's being pushy. So I'm about to like really let him have it, because I'm like, you're really bothering me. And I picked up, he said, Ursula, your video's gone viral. I told you. I'm like, I don't know what. He said, your Facebook is blowing up. And I didn't want to be a dope. No clue what he was talking about. So I said, you know what, let me call my son. So I called my son, and my son's 23 years old. And they know everything about everything. And so I said to him, I said, Kevon, check my Facebook and figure out whatever is wrong. Can you please fix it? He called me back. He said, Mom, I can't fix that. You wait until you get home. So all the way home, I'm worrying. I'm like, did I say something wrong? Is somebody reacting to what I said? And I got home, and he's like, this is what I'm showing you. I'm showing you that you've gone viral. I'm like, how do you even get to see what number is Pastor Graham looking at to say that? So yeah, that was quite an impressive event. I noted that throughout the day, my phone just kept buzzing with all these friend requests, but I didn't know the people. And so I was like, initially I started like, I don't care if you're my friend on Facebook, because I don't put anything on Facebook. And so initially I started accepting the friend request. And then when I spoke with Pastor Graham and I told him about the friend request, he's like, no. Don't accept all those friend requests. Just leave them. Just ignore that. You just leave it. He's like, well, you'll need to do another video. I'm like, listen, this is not part of the deal. I'm not doing that. And so he was like, Ursula, you have to start to read the responses so that you understand the impact. I think what really made me stop and pay attention, to be honest with you, was I got one call from Nigeria. And when I said, I'm looking on my phone and the phone call is coming through Messenger. And I'm like, I don't know anybody in Nigeria. But the reason I answered it is because it said doctor. So I'm like, doctor? A doctor from Nigeria calling. So I answered that call, and he was just grateful. He was saying thank you. And so I said, thank me. What are you thanking me for? He said, several patients had come to his clinic with their phones in hand to say, doctor, this nurse in Washington says I have COVID based on the symptomology that I had described. And he's like, I just want to tell you thank you. And so that made me stop and pause and start to at least screen the people trying to call me. The second call that made me really look at, and this came in on Tuesday morning, the doctor was calling from Australia.
Okay.
And he was saying he's got 3 patients, 1 in the ICU and 2 that were hospitalized that owed me their lives. And all I could say is, to God be the glory. All the praise go back to him, because to be in the right place at the right time and to be encouraged by the right people, that in itself was a blessing. So,
amen to that. Now, you did get calls from Italy too, didn't you?
yes, I now have friends in Italy.
Very good. So how did you get these calls from Italy, and what happened?
The friends in Italy came kind of like on the same vein. I got several texts from Italy, several messages from Messenger, 2 doctors who they work at the same hospital who wanted to call to say thank you and to share with me so that I could share with my audience that I didn't know I have, to share with my audience that they had, because what I was saying resonated with what they were already feeling, they actually went against the World Health Organization's advice and did autopsies on the COVID patients' bodies and found that what we were assailing were actually true. That these people who had died really died from blood clots. And so they literally watched their death rate drop significantly because they are treating even patients who had just a mild form of the virus, but had already started having respiratory problems. They're treating them with antibiotics and blood thinners to thin the blood and prevent the clotting of the blood vessel, the blood in the blood vessel.
Okay, so a question for you then with this is, when did we in the US start doing this? Is it just recently, or were we always doing this?
I don't think we were always doing it. I think that most of the folks was following the CDC guidelines. However, I know the doctors at Doctors Hospital and PG and some at Holy Cross were already questioning what they were seeing and trying other things, such as the anticoagulant therapy. I think anticoagulant therapy is now a part of our standard toolbox of using to fight this. You have other things that may prevent the doctors from being able to use anticoagulant therapy. I know that, like, from today, we've just lost a mother in Israel, and people are asking me, well, why didn't they use that? Sometimes the underlying disease process that the individual may have had would prevent that person from being a candidate for anticoagulant therapy. So, but we've seen much improvements on folks not even getting to need the ventilator, because we're finding ways to oxygenate them before this happens.
Okay, and for those out there who don't know what anticoags and oxygenates is, could you explain that, please?
Our body has a natural mechanism that allows your blood to clot if you get cut. However, in the situation of COVID-19, what we're seeing is the body goes into an overdrive situation and cause those clots to form outside of the need of a cut. So it's bruising the virus as it was, bruises the inside of the blood vessels, and the blood vessels go into that hyper state of forming clots. Now, when the clots form, it prevents the blood from flowing. And the most important things that blood does is to take oxygen and nutrients to your body. So literally, it doesn't matter whether it's your heart, your brain, your limbs. If we can't get oxygen and nutrients to your body begins to die. And so that's how folks are dying from COVID-19.
Okay, so now from your Facebook video, you said you were seeing differences between blacks and other races, whites, etc. Now, question, what differences were you seeing and why do you think these differences were there?
Well, initially, we weren't 100% sure what was going on, but blacks weren't even being tested because the criteria for being tested was that you had to have a temperature greater than 101 and you had to have a dry cough. Most of our black folks weren't showing any of those symptoms. What they were showing was they would feel, when we call malaise, it's like you're about to get the flu and you just don't feel good. You want to lay down. And that's when they were calling their physicians, they were being told, just go home and lay down. And several of our race were found in bed dead, or by the time they realized how short of breath they were and got to the hospital, it was either too late or fortunately for one of my good friends, her sister-in-law was a nurse and recognized that she was having difficulty breathing. And so they sent 911 to her house. She turns out that she had 6 clots in her lungs already.
Wow.
So those were the differences. One of the things that you're not hearing on the mainstream media is that we have seen this virus almost as if it's growing legs and arms, as somebody asked me, and like, no, it's doing what viruses do, it mutates. So when we first heard of the symptoms, you had a cough and you had an elevated temperature. We've heard people complain of headaches. We've heard people complain of pink eye. We've heard people complain of lack of taste and smell. We've heard people complain of pain in the extremities or blotches of, like, somebody hits you or you have bleeding under the skin, on the feet and the toes, especially in children. And so when we first got told about the virus, we were told that the people at risk were our seniors. One of the things I want to encourage our Black folks to do, and which is why I'm even doing this, is that we need to start to read for ourselves. We need to start to pay attention. Each state has a website up that's telling you about your state, your part of the country where you live. You need to get on that website and see what's going on around you. The time to bury our heads in the sand is gone. When you look at the state of Maryland, for instance, 90% of our deaths is not necessarily in the nursing home, as the mainstream media is telling us. It's between the ages of 20 and 50, smack dead. That's who's getting it, okay? The only reason we're not dying at the same rate as our seniors is because we don't have as many underlying diseases. Now, somebody asked me, why is Blacks more at risk than other folks? We've got two main issues. One, this Black skin that we have, each of us needs sunlight. It don't matter if you take vitamin C in, your body needs the sunlight to convert that vitamin D so that your body can work. Now, here's the thing. Our immune system must have vitamin D to work. For vitamin D to work in our system, we must have magnesium. But because they have sprayed our food with pesticides, most of the magnesium has been destroyed from your food that you take in before you even get it. Okay? I'm a good example of that. For years and years after my hysterectomy with low blood, my doctor put me on vitamin D, 3,000 units. She was getting mad. She really could not believe that I was taking it because my vitamin D level was not even traceable on my blood work.
And so wait a second. So you said you are taking vitamin D 3,000 grams, which is a lot, and it's not traceable?
And it wasn't traceable, okay? Here's the two things I had going against me. I was a nurse working the night shift, okay? So I went to work at 7:30 in the evening and came back at 7 in the morning and was indoor asleep most of the day. I got no sunlight, okay? And it really took somebody talking to me about it that my mother recommended. He's a herbalist, and he said, Miss Allen, ask your doctor to check your magnesium level. And if you think my vitamin D level was low, magnesium was non-existent. I started taking magnesium based on the recommendation of the herbalist. And within a month, my vitamin D level was normal.
Okay, so for definitely then, you are one who would totally recommend magnesium along with vitamin D.
I don't do without it. Most of our people suffer from constipation. Now, I know people like, you can't talk about that on national TV. But that's our bodies. Anything we go in must come out. People tell me they haven't gone to the bathroom for 3 days. That is not normal. After every meal in, something needs to come out. It's one long tube. And anything going up has to push what's down out. And your body needs to eliminate. That's the way God intended us to work. And we'll find that people just don't talk about being constipated. And we think we're too busy. We don't want to go to the bathroom in public bathrooms. We don't want to go to the bathroom so often. And so we think it's normal, but it isn't. And so this is our bodies saying to us, something is wrong. When your body has enough magnesium in it, you're not constipated. You go naturally. And actually, your body's ability to eliminate tells you how much magnesium you need or don't need. The herbalist told me, he said, go up as high as 1,000. And when your stool gets too soft and watery, back off until you get to the right consistency, and that'll tell you that you have enough magnesium on board. Since I started with magnesium, then I don't need anything else. Okay. But this is where we as Black people are deficient. So our dietary intake makes us deficient, but our Black skin requires, unlike our brothers and sisters on the Caucasian end of the spectrum, who just need limited sunlight, we need at least 20 minutes in that sun to make our bodies work right.
Okay, so that's 20 minutes each day at a minimum.
Each and every day. And even when it's overcast, you'd be surprised how much UV light comes through.
Okay, and does that change winter, summer, spring? How does that, any difference?
It doesn't matter. And so during the winter, outside is cold, sit in the sunlight through your window. Sit near the sun. Your body needs, let's be honest, when you've been outside in the sun, you feel better. It goes back to the 8 laws of health that our church preaches. And we need fresh air, we need sunlight. Most of us as Blacks, we're on the front line. We're the frontline workers. We go, and those of us from the Caribbean, you know us, we got 2 and 3 jobs. So we go, 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 go. We're not out in the sun anymore. Our forefathers were strong because they absorbed all that energy from the sun. We don't do that anymore. Come on, we Black, we trying to get lighter. We're not trying to get darker. And so we don't want that sun on us, but our bodies need it. And so because we're so deficient, even when we're walking around looking healthy, our immune systems were already compromised before COVID-19 happened. So when COVID-19 happened, we're frontline workers, our immune system is compromised, and most of us don't have no doctors. They were saying, call your doctor, right, to get permission to go get the test. I'm not gonna call my doctor when my doctor is the emergency room, and I can't go to the emergency room. And so that's what set us up. That's what sets us up for it. My recommendation to folks right now is we have to be smart. You've got to take care of you physically, and because we're still the frontline workers, I was talking with 2 of my nurses the other day, and they're like, Ursula, it doesn't seem fair, okay? Because most of the nurses that I work with are Black. And most of the therapists are white. We're not sending in therapy first. We're sending in the nurses first. Even in the hospitals, the nurses are going in and nobody else is allowed in that room other than the nurse. So you automatically, you're on the front line. You're the ones that's most at risk. And we need to make sure that we're taking care of ourselves. We need to make sure we're taking care of our families. We need to make sure we're standing up for ourselves. If we're not getting the right protective equipment, we need to say, I'm not doing that. You know, we need to stand up for ourselves.
Yes, because everyone definitely needs to be protected. Now, you spoke about some malaise. Now, that malaise you spoke about, is it any different now to what someone will normally feel? And the reason I'm asking that is because I may have felt a little weak and tired, so I might think, well, it's normal. That's how I usually feel now and again.
Well, that's the differentiating factor, because the people who I've spoken to who talk about this is how they feel, they also talk about the muscle pain. Okay, that muscle pain tells you that something definitely is wrong. And so you want to make sure that you get it checked. There's nothing wrong with getting checked. And right now, I think they've come to recognize that this is an issue for Blacks. And so they're no longer telling you need to get a doctor's note to get your test. Go get yourself tested. Should be on the safe side. The other symptoms that we're now seeing, which is the more than one of the newer ones, other than what's going on with our children, is the nausea and vomiting. My dad actually is a COVID-19 survivor, and for that I give God
Amen
thanks.
to that.
He had nausea and vomiting. I think they said he vomited like twice, and then he was found unresponsive. So they're telling me that yes, that is a new symptom that they're seeing, nausea and vomiting. And like a day after my dad came down with that, I started hearing it on the news.
Okay, well, I am so happy to hear that your dad is better now.
Thank you.
And it seems like the symptoms on these things, they're evolving. Is it that the virus is expanding? That sounds scary. That sounds somewhat scary. So are you seeing any difference within us?
The word is mutation. That's what viruses do. They mutate. What does that mean to us as a public? Some people are like, well, I had the virus already, and so now I don't have to wear a mask. Guess what? You had the flu, but you come down with the flu again, because in every flu season, we have multiple strains of the virus. Right now, in the healthcare, they're admitted to at least 3 strains. But when you look at the different symptomology, you can more than likely attribute a different strain of the virus to the different symptoms that you're getting. And so you need to be careful, knowing that one, it's not over, no matter what our dear president says. Two, with what's going on in our country today with all the rioting and the demonstrations, yes, you can participate, but take care of yourself. Wear your mask, wash your hands, keep your hands away from your face and your mouth. Just take care of yourself. Where it's trying times, but the people who are still at risk is still us.
You know, and speaking about being at risk, and I have a question about the medical professionals, because you know you supervise many of them, and I know a lot of them, you know, they are trying their best, they want to do what's right, but they feel discouraged at times when they see what's going on. How do you encourage these people?
I think one of the big issues is just to listen. I've had nurses who I've had to say to them, pull over to the side of the road. Pull over. It's not easy getting told you have to go see a patient who's known COVID positive. But as I said to one recently, at least you know the dragon, so you can arm yourself. The problem we're having is that we will go in, they'll tell you this patient is COVID negative, but 3 days later, I'm sending this patient out 911 because they've got all the signs and symptoms of COVID. And that's what's making our environment even more critical. When you look at the Chinese, China put the epicenter back into lockdown. Everybody's being tested so that they can identify who's infected and isolate those people. In our country where testing is not being done as widespread, then we have to protect ourselves. As you go out, I need to do you the favor because I don't know if I'm infected, and you need to do me the favor because you don't know if you're infected. So if everybody protects, act as if everybody else is infected, that's the way we stem the virus.
So with this, so going forward, some states are still practicing social distancing and some are not. So are you recommending that we should still practice social distancing while this mutation is going on, or what are you saying?
Most definitely, most definitely. I will tell you, healthcare workers are bracing for the second wave that's going to hit our country. Yes, we're better prepared than the first wave, but we're still a nation where we have limited manpower. We talked about the nursing shortage before, and we've always had a nursing shortage. It's never ever been really resolved. We brought nurses back out of retirement this time to help with the with the crisis. But as you look at it, in bringing them back out, they're seniors. Some of them have multi-systems issues, and so they're also at risk. Are they willing to go back on the front line? A lot of them are saying, no, we're not doing that. You know what I'm saying? We haven't always been very nice to our nurses as we see them get older, and to let them go with the dignity and respect of the years of service they've put in. So now there's a lot of them who we've called and they're like, forget it. You all dumped me out. I was too old to work before. I'm not doing it now. And so those are things we're having to struggle with. But I truly think at the heart of every nurse is a missionary calling. We don't do what we do for money. Nobody could ever pay me to empty their bedpan or to disimpact them from stool. But we do it because the love of Jesus acts in your heart. It has to be. It's the one thing that drives us. And so we take care of these individuals because they need to be cared for. I've had nurses who were petrified about going to see the COVID patients. But after going and seeing the patient and seeing how grateful that they are that somebody came in to help them, to tell them what to do, they felt that they were, as it were, rushed out of the hospital to make space for the next patient. And they're still scared and they're still wanting somebody to make sure that they're okay. The nurse walked away. She's like, you know, Miss Allen, I'm glad I went. I'm glad I went. And I called them back later that evening just to make sure they were still okay. And I've had them call my office to say, Miss Ursula, thank you so much for sending us the nurses to take care of us. That's why we do what we do. That's what makes us maybe not rich in money, but rich in gratitude from those who we take care of.
Very well, and I'm sure it does something to you. It warms the spirit. It feels like it's your mission. It feels like it's missionary work, and you are making a difference to
It's the
others.
fuel that makes you go back to work on Monday morning.
Yes. Now, for those who don't understand, it will sound strange. I have COVID, and the hospital is not taking me. It's asking me to stay home. For those who do not understand that, could you explain why that happens?
Well, because currently unless you are in a critical situation where you're having difficulty breathing, there's very little that the hospital can do for you. And because we are limited in terms of our beds, we're limited in terms of our staff, we need to keep it open for those who are critical. Prior to COVID, most of our hospitals were probably on the financial brink of where they need to be. Medicare has recently changed our payment structure as healthcare with the premise of saving money and eliminating fraud from the system. And every system has some fraud, but for most hospitals, this change in payment structure already meant a cut in about 25% of their revenue. So putting COVID on top of that really is putting a financial burden on facilities. And so a lot of our middle management individuals, a lot of our office-based workers are either furloughed or has lost their jobs.
Okay, so would there be any change? Have you heard of any changes as far as administration, as far as policies, or anything that could accommodate the COVID patients any better, or this is what's going to happen
No,
for a while?
I sit on a call every afternoon for the nursing home just because I want to know what's going on with my dad in there. And right now, our governments are telling the nursing home staff, patients, and administration, patient and staff needs to be retested multiple times. What they haven't said is who's paying for it. Okay, so if your nursing home staff does not have health insurance that will pay for you, not only testing them once but testing them multiple times, or that Medicare and Medicaid aren't agreeing to pay for this, then you're asking the nursing homes that already operate on the slimmest of margins to pay for not just the additional PPE, but the additional expense of testing everybody. And you have to understand, even if I test you today, but you work at 3 different nursing homes, the fact that you work at 3 different nursing homes, that means tomorrow you come back. Technically, before I let you in the building, I should test you again.
I understand that. Now, I will ask you a question about you, because, and this may help spouses who may have medical professionals. You know, sometimes I'm sure you go home. Sometimes you may feel to talk. Sometimes you may not feel to talk. It all depends on the pressure of the day. So we may have spouses of people, of medical professionals who are trying to be supportive, who understands the pressures that you feel each day. How can they best assist a spouse who is a nursing, a medical professional?
I think most important, if your spouse needs to talk, just listen. Understanding that even when you think you understand, you really don't understand, because there's so much that goes into what we feel for the day that we may not be able to really articulate. And so just being there, listening, a gentle touch, a hug, says that you're there for me. I know when in driving myself home, I give God thanks for my garage, because I would get in the garage, close the door down, and sit there long enough for the lights to go off. But I just needed to decompress, so that I don't come into the house with that, because I don't want to bring that home to my family. By the time I come in, I could tell you about my day, but I could make it lighter. You know what I'm saying?
Yes.
And then there are days when I really don't want to go to work. And I need to recognize those days in myself. And so I plan my day. We're supposed to be allowed to have a 10-minute break in the morning and a 10-minute break in the evening, 15-minute break in the morning, 15 in the afternoon, and a lunch hour. There are days when you have to make yourself take lunch. Because as healthcare workers, we don't take lunch. My break is going to the bathroom. And even that some days you don't really do as you're supposed to. So on days when you know your stress level is up, we need to take better care of ourselves. I found going outside and getting my 10 minutes in the sun. I'll just go outside and sit on the wall And they're like, well, or so we were looking for you. I said, but I left message that I was going outside. So I'm going outside for my 10 minutes. That fresh air, that sun on my skin makes me rejuvenate, and I can go back in and face it again.
So it sounds like you are saying while you take care of others, you need self-care. You need to take
Yes,
care of yourself.
that's definitely true.
Okay, great. Well, Ursula, thank you so much. My last question to you would be, how has your faith in God helped you all through this? And if you have any additional comments for our viewers.
Actually, I thought I was solid, but I must be honest. I I had a gift given to me in over the Christmas, and I was amazed at how God really works in our individual lives. It's almost as if He knew at this time that I was going to need that devotional. It's called Jesus Calling. And in this devotional, the author writes as if God is talking to you. It's written in the personal. And there have been many a days when I need that personal communication where he tells me, for instance, I know the plans I have for you, plans to prosper you, plans to give you a hope and a future. There are days when I need to be reminded of it. There are days when I'm like, you know what, I think I need to take the book to work with me. But then I'm afraid because every book I take to work, somebody wants it more than I need it. And I'm like, I'm not ready to share. But I've copied and taken pictures of pages to send to colleagues. Um, we talked about the matriarch of our church who passed yesterday. And last night I was on the phone with her daughter, and I was able to pull my devotional and read to her that God's got a plan for us. It may seem dark. We may want to scream and holler, but he's asking us to trust him through this period, that he's got a plan. And so it's allowed me to take a different look at what's going on around me. There are times I need to zone out from the TV. I thank the Lord for the Sabbath. My husband is like, well, Ursula, the Sabbath's over. You wanted me to tell you? I'm like, no, I really don't want to hear yet. I just needed to zone time. And we need to know that about ourselves. We need to be able to give ourselves that extra that you need. And we need to be ready for that. What I felt is I felt the Savior draw me closer. I, as a nurse, we tend to want to fix everything for everybody. And he's shown me that that's not your role, boo. Your role is to pray. Your role is to encourage. Do your part, but know and trust that I've got this. I don't need your help. I've given you a task to do. Even when this whole video thing, he's like, you prayed that morning, Father, use me. And that's, I think, what he's calling us to do. If we truly mean that he should use us, then he will create those opportunities and show us where we need to go. Since this event, I've had a lot of opportunity to speak with not only Adventist churches, but also some of my Sunday connections, and spoken to churches who worship on Sunday, huge communities. And so I go in, yes, I'm going in to talk about COVID, but I'd be done. I'd be, I'm like, okay, God, this is my opportunity. Help me to know how to present myself. Help me to know how to pass your message on. and to show them who you are and what you want for us. I truly believe, Clem, that God is wrapping up. These are end times. And I believe that he's calling us to action. He may not want you out there throwing Molotov cocktails at folks and burning up police cars, because that's my tax dollars you're burning up. But he do want us to stand for right. He wants us to support our people in what we know, but he also expects our people to listen, to do the things they need to do. He's calling us to be a responsible force for what he's already given us. And I think that's how I've seen me change, to know that I had my plans of what I want to do. It wasn't this. This wasn't it. If you'd asked me this was what I was going to be called to do, I was like, no. We laugh at church on a regular basis because every time they put me up front to say something, I just go into an all-out sweat. So give me my little people. Let me talk with the kids. But this is not who I wanted to be, but this is where God says, in this space and in this time, this is what I need from you. And if we say, here I am, God, use me, then whatever you will, Father, that's what I'm willing to do.
Well said. Well, I'm glad that you have allowed him to use you, a willing vessel who has reached out to individuals in Nigeria, Australia, Italy, and who knows where, because you have your message is all out there. And I'm hoping, in fact, I know anyone viewing at this today, they would have been blessed and they would have been helped. And one of the things that you mentioned, vitamin D and magnesium, it sounded very important. And I'm hoping that a lot of us do stock up on our vitamin D and magnesium. It will. Well, Ursula, it has been great having you here. I am glad that you said yes and you did not say you were going to stay away from social media. And I thank you once again for joining us and educating us about COVID-19 on Chronicle Corner.
Thank you for giving me that opportunity.
You are so welcome. So viewers, we had Ursula Roberts-Allen. She said a lot, and I am hoping that some of the points and some of the recommendations that she made, you will do it. Today, I guess I'll have to go on Google, look at magnesium also myself, and make sure that I get my vitamin D. So until next time, viewers, this is Clem Hackett from Chronicle Corner. Thank you so much for viewing, and remember always, God